Hey everyone! Last week in the CT image quality lecture we talked about how to view CT images. CT images and MRI images look almost identical. Most people, until you get really good and used to looking at these type of images, would have a hard time distinguishing between a CT image and an MRI image. So rather than do basically the same lecture except with MRI images, I just want to focus today on the different aspects of an MRI image and the different artifacts that they get, because this is where the real difference between MRI and CT is. CT doesn't get these type of artifacts, and so when you're looking at images from the MRI machine and you see these weird things happen, you'll at least know what they are and have an idea of what causes them. So 4 things to look for in an MRI image is spatial resolution, image contrast, signal-to-noise ratio, and artifacts. Spatial resolution. Spatial resolution determines how sharp the image looks. Low resolution will give either fuzzy edges or a pixelated appearance to the image. In MRI, spatial resolution is defined by the size of the imaging voxels. Since voxels are 3-dimensional rectangular solids, the resolution is frequently different in the 3 different directions. So different planes, axial, sagittal, coronal, will have different spatial resolutions. The size of the voxel, and therefore the resolution, depends on the matrix size, the field of view, and the slice thickness. Thinner slices have better spatial resolution and produce sharper images. Image contrast. Contrast is the relative difference of signal intensities in 2 adjacent regions of an image. Due to the T1 and T2 relaxation properties in magnetic resonance imaging, differentiation between various tissues in the body is possible. Tissue contrast is affected not only by the T1 and T2 values of specific tissues, but also the factors in the magnetic field strength, temperature change, and many other factors. And hopefully you paid really good attention last semester in RAD T110 and you did well at MRI physics, so you know what the difference between a T1 and a T2 is, and I'm not talking over your head. Good tissue contrast relies on optimal selection of appropriate pulse sequences. Signal-to-noise ratio. The SNR is a term heard commonly in MRI circles. The SNR determines how grainy the image appears. The more grainy, the lower the SNR. The SNR is measured frequently by calculating the difference in signal intensity between the area of interest and the background, which is usually air surrounding the patient. So the signal-to-noise ratio can be improved by tweaking scan parameters, increasing the field of view, decreasing the matrix size, increasing the slice thickness. And these are the MRI artifacts. MRI artifacts are numerous and give an insight into the physics behind each sequence. Some artifacts affect the quality of the MRI exam, while others do not affect the diagnostic quality but may be confused with pathology. The zipper artifact. These are bands of electronic noise often caused by the door being opened during the scan. If you see a herringbone artifact, also called a crisscross artifact or corduroy artifact, it appears as a fabric of herringbone, and it's often caused by a fluctuating power supply. Zebra stripes, alternating bright and dark bands in an MRI image. Central point artifact, a focal dot of increased signal in the center of an image. It's caused by a constant offset of the DC voltage in the receiver. RF overflow artifacts. This is a non-uniform washed out appearance to an image. This artifact occurs when the signal received by the scanner from the patient is too intense to be accurately digitized by the analog to digital converter. And last but not least, the shading artifact. It's a loss of signal intensity in one part of the image, leading to dark shading in this portion of the image. It's due to RF pulses applied at flip angles other than 90 and 180 degrees. So, I know I put your MRI physics to test with that. I wish I had images of each of these artifacts that I could show you, but usually these images get deleted. They're not sent to PACS. When you see those artifacts, they're usually, not kept because they are low quality and they're not good for diagnosis. So, if we see one, I'll be sure to point it out. Thank you for listening.